Welcome to part 3 of Home Health CAHPS surveys with Minnesota Rural Health Co-op. Let's get you started. Preparing your facility to get started with Home Health Care CAHPS. A couple of tips for you are to get started gathering your baseline data on your current patient satisfaction scores. You want to review last quarter's reports and comments, review questions on your current survey and how they would relate to the Home Health CAHPS questions, and provide measures to improve patient satisfaction. Want to build one really important thing is to build your staff's awareness of Home Health CAHPS. They need to know that these things are happening. Get them on board. However, do not encourage them to talk to the patients about how they answer the survey. They cannot influence the patient's answers to the surveys. And of course, discuss the results and provide the feedback to your staff. The survey timeline that you need to be considering is you need to get contracted with an approved vendor, that's us, and get logged on and registered. Then you need to get your patient data to the vendor. And one of the vendors that we are proud to work with is CareFax, and we do have an IT person that can help you collect your data if needed. Then we will get the surveys mailed out, and as we receive the data, put the projects together and then report the data back to you. There is a lag time in between the second mailing, but of course once we get all that in, it's about 4 to 6 weeks before we can return the data to you. CMS does have some guidelines that we need to follow with the Home Health Care CAHPS. The questions must remain in the specified order, and we have that order, so you don't have to worry about that. No question or response can be altered in any way. It has to be exactly as they have it printed. Again, we have those guidelines. And CMS will provide the questions in English and Spanish only. A cover letter must be included with the survey, and we do produce those surveys. And again, you must use a required approved vendor, and MRHC is one of those 34 approved vendors. Here's a sample copy of the survey. Your facility name would be listed on the top, and then these are the 34 required questions. And as I've mentioned before, there is room for 7 additional questions that would be facility specific. So if there's something that you're concerned about specifically, we could add those in. And we do like to point out that at the end of each survey is room for comments, and we've found that these have been very helpful to our participants. This is just a little view on one of the questions that is asked in the survey, and this is how the report will look. On the left side, you'll see MRHC survey participant average, and then on the right side is your data exclusively, and so this would show your facility's data there. So here's www.mrhc.net. We're very proud of our website. It's very user-friendly. If you see then across the top with all the tabs, once you get logged in, you'll go on up and hit surveys. And here's a list of the surveys that we offer. See those, and there's the hospital CAHPS, and then while you're tuned in here is the Home Health CAHPS button. And here are a few more questions. Hopefully we've already answered those, but if you need to go back and double check, here's answers to our questions. Contact information, see here on the bottom, contact Heather. She can provide the discounts that we're offering currently and our competitive pricing. We are glad that you joined us for part 3, and look forward to working with you and just showing you how much customer service means to us, and we can help your facility. Again, contact us so you can get started on those dry runs. Our phone number is 877-481-6251, or contact Heather by email. Thanks again for joining us.